my pleasure to talk to Randy today. It's always so great to see Randy on our virtual and in-person events. And so I'd love if you could please give the audience a brief background on yourself, and then we'll get right into the content.
Sure. Ansley, and thank you all and the HITLAB team for allowing me to speak about topics that may not be near to many of us, but it's critical to realize the importance of having a robust supply chain management program. So I serve as the director of supply chain over NewYork-Presbyterian Hospital, and in essence, my team is responsible for ensuring that all disposable supplies, and we'll discuss a few of them today, are readily available for patient care, and that ranges from receiving, the ordering, the distribution, some layers of contracting. So excited to connect the dots with how those processes connect with the critical importance of breast cancer screening and treatment options.
Yes, absolutely. And can you describe how an efficient healthcare supply chain can actually impact the availability of breast cancer screening and treatment options?
Sure. So, Inzi, I'll term it as, and this may not be thought about so readily to those who are listening, but the supply chain impact is pivotal. Why do I say that? So you think of all the things, whether it's equipment or supplies that go into breast cancer screening and treatment. You have mammography machines, you have biopsy kits, you have dyes, you have treatment medications. All of those need to be accessible at the point of care and at the right time, at the right place, in the right quantity to ensure that there aren't delays that could hinder patient care. So just to give an example or two, like when you think of mammography machines and the associated consumables, that's the dyes, the films, all the biopsy kits, all of that has to be readily stocked. So when patient ABC walks into the room for that care, all of those components are readily available. And it's now more than ever, whether you're seeing it, and not to go too off topic, whether you're seeing, hurricanes that are impacting shortages of IVs and other critical supplies, it's easier said than done. I'm sure many folks are saying, Randy, why, just have them readily available. I wish, the world of supply chain is becoming so complex. But, to get back to the topic at hand, when it comes to the other side of the supply chain, the pharmaceutical side, ensuring that drugs or hormone treatments are ready for patients, and just access to like linear accelerators, shielding equipment, the specific radioactive isotopes that are just needed for screenings and treatments are essential. And, I can go on more and more, Ainsley, about the anti-nausea medications and PPE, but I'll just term it at having a well-coordinated supply chain, whether it's with your distributors, whether it's with your manufacturers. It's fundamental to achieving better patient outcomes, which help to drive extending life. So I'll leave it at connecting those dots with supply chain. You heard it here first, connecting supply chain management to the ability to extend life.
And I will say, just for me personally, I don't think I've ever connected those dots before myself, thinking of how supply chain actually can affect breast cancer screening because of all the stuff that you need in order to make this happen, like you mentioned, and same with like hurricane and natural disasters. You don't I just don't think about how supply chain is so crucial to getting all of these needed medications and everything else to kind of make the system work. And so I think it's so important that we're talking about this today because I hope we at least create awareness for other people that supply chain is really critical behind the scenes to make kind of our healthcare world go round. And so, on that topic of, understanding that, how can data analytics in the supply chain also be used to help identify gaps in the breast cancer care accessibility?
Sure. So a great question. And I think there's two buckets of utilizing some real-time information and then predictive information. So Ainsley, to briefly touch on the first, I think everyone may be aware, but if not, this world of having sensor tracking, of knowing where you are expected to receive a shipment of supply A, B, and C, where it is in real time. I think we're all used to as humans, I think the previous speaker referenced the Amazon of the world. You order something, it comes the next day. Oh, if life were so simple in healthcare supply chain where you order something and you'll have a tracking number, but you won't exactly know, hey, it left this dot. We're not advanced enough yet, but I think getting to the point of having real-time data can allow healthcare supply chain professionals and even providers to understand how much of something am I using. As health systems become larger and care is in an urban setting and rural settings, we can then measure, those systems can then measure like, geographic disparities in how resources, and I'm speaking specifically from the lens of supplies, how they're
Right.
allocated, and then try to detect those bottlenecks. So the movement towards real-time data will help immensely. With real-time data, we can become a lot more, and I'm using some buzzwords, but they're so relevant and will become more and more relevant in supply chain, having the ability to predict and anticipate from a supply chain perspective, not seasonal demands, but then also utilizing real predictive analytics to just proactively address shortages. Where you may, for example, to connect to my first answer, you may say, oh, this region of our health system tends to be running low on the screening resources, whether it's the mammographies or the biopsy kits, and how do we create targeted interventions around that? So I'll end this question by saying connecting the real time tracking and the predictive. Again, bold, big claims, and that's why I'm here. Supply chain can effective supply chain management is critical towards population health management and ensuring specifically like high risk areas have some resources to help them
Yeah.
receive the care they need.
Absolutely. And I also want to just like understand what are your recommendations also that you would give to other organizations who are looking to improve their supply chain practices, while also being a little bit more specific to promoting breast cancer awareness as well.
Sure. Ainsley, I will like to hit on four of them. So I think the first is, in a supply chain organization, hospitals, you contract with thousands of suppliers or vendors. I think developing partnerships with suppliers that are prioritizing health equity and in their mission statement or in their vision statement, it is critical because I think you'll find those organizations, although they may be for profit and margin driven in some sense, they will have a commitment to serving those in underrepresented or underserved areas. So number one, partner with organizations that are prioritizing health equity. I think number two, connecting back to the second question, is really incorporating data analytics predictively and in a real-time manner to help understand how resources from a supply perspective can be allocated. And I'm a supply chain guy. That simply means to me like how to determine like where things go and the logistics
Yeah.
of supplies. The third, slightly connecting back to the fourth, large organizations, having their supply chains connected back to community-based initiatives, having organizations that are able to donate supplies
Oh
to
yeah.
organizations. I mean, sure, everyone hears about hundreds of thousands of dollars worth of MRI machines and how expensive those are, but biopsy kits are relatively affordable for hospitals to engage with community-based initiatives to help donate. And I think that the last thing I'll say, and connecting back to the element of data, it's just we're entering this era of, or I'm optimistic that we're entering an era into transparency and noticing more about how things are produced, where they're produced,
Right.
and tracking those life cycles, and just extending that transparency to the public, I think will help to build trust, especially when you're talking about breast cancer awareness and breast
Mm.
cancer treatment. It's critically important that that healthcare professionals get this right. But as a
Right.
supply chain leader, I would say focusing on these four recommendations will help promote breast cancer awareness and just really drive us forward.
Yeah, absolutely. And Randy, I want to put you on the spot here just really quickly and ask you one more question because
Sure.
I'm intrigued from this conversation. Where do you think that the supply chain innovation is headed in the next couple of years for the future? Do you see there being, more awareness, more equity behind this that is really going to be able to connect those dots more? And in the case that we have another unfortunate natural disaster, how can we easily, overcome this with, connecting those dots?
Yeah, Anthony, no, and I really appreciate that question. I like it. It's a hot seat question. It's I'll leave it simply as, I'm optimistic that, generative AI and as organizations begin to incorporate AI sensor technology, which healthcare lags. I'll be very candid with you. Hospitals lag, even the big med tech providers are not where they need to be. I mean, Amazon and Walmart may be the market leaders, but not directly tied to healthcare. But I
Right.
think as organizations incorporate more of that intelligence at a sensor level, at an AGI level, they'll be able to then, pull data to say, hey, where are these critical supplies? Or hey, we had a significant disruption. Here's what we have on hand. Here's what we
Yeah.
can distribute. So, but Ainsley, I'll leave it more around. I'll leave it in the short term as, AGI sensor technology is the path forward to aligning supply chain to
Absolutely.
so many critical areas of healthcare.
Well, thank you so much, Randy, again for again connecting the dots with supply chain and breast cancer. It was super informative for me, and I'm sure to our audience as well. It's always a pleasure to have you, and we hope to have you again in 2025, and hopefully get to have you in person at our May Summit as well.
Yes, indeed. Thank you all so much. Take care.